Yeah, we'll call it Teachable Thursday. Want to educate you on an issue medically that none of us really had any idea about. For more, here's me. Yeah, we have a pretty eye-opening demonstration today for the wide world of medicine. We talk a lot about hospitals and patient safety, but what about the people that work there, the nurses, the doctors, the surgeons? We want to take you inside the OR, the operating room, and talk about surgical smoke. Nick McGinnis is here. What is surgical smoke?
So bottom line, Chris, surgical smoke is burning flesh. Surgical smoke is a byproduct of surgeons cutting and cauterizing tissue during surgery, and it happens in about 85% of surgeries across our nation every single year. And the crazy thing is, studies have shown that smoke from the OR, just one single day in the OR, can be equivalent to smoking up to 27 to 30 cigarettes a day.
Unbelievable to think that these people are being exposed to this every single day they're at work in the OR. I know you're going to do a demo to prove it, correct?
Yes. So within this box, I've got a piece of meat here. I'm going to try and replicate what it looks like in the operating room when a surgeon cauterizes tissue. And I'm using, this is called an electrosurgical pencil. It's exactly what surgeons use today. And what you'll see, as soon as I start to cut on this meat, this will begin to fill with smoke. And I think this is a really impactful demonstration because in the operating room, smoke will move at up to 40 miles an hour. So you're not always going to see it accumulate, but you're always going to smell it. But this is, you'll see after maybe 30, 60 seconds here, this box will just fill up with smoke. And it really puts in perspective how much smoke nurses are breathing in the OR over the course of just a 6 to 8 hour workday.
Obviously, the smell is something that's unpleasant as well, but that's the least of their concerns. That smoke is something that they are being exposed to each and every day. And up till now, there's not any universal protections, right?
You're correct. So there have been a couple states throughout the country, it's actually been Rhode Island and Colorado, have been the first two states to pass legislation mandating smoke evacuation in the OR. There's a few other states who are planning on introducing legislation, but by and large, across our nation, we're not doing much about this problem.
Wow, that's pretty concerning. So we're talking about the problem solution. You have an example of one of them rather than putting ventilation in the rooms, which is obviously the bigger picture. This is something that could help do the job?
Yes, so this is Stryker's Safe Air Smoke Evacuation Pencil. It looks just like a standard electrosurgical pencil that surgeons will use in the operating room, but it actually has a port built into the bottom right here where if you were to attach this to a vacuum source or a smoke evacuation system, it would evacuate the smoke directly at the site before anybody in the room could be exposed to the hazardous smoke.
Unbelievable. Who knew this was even a problem? Nick McGinnis, thank you so much for this. Thanks for helping us look out for the folks who are looking out for us in the OR.
Sure. Thanks, Chris.
All right. Yeah, who knew? Surgical smoke, it's obviously nasty. It is burning flesh, so that comes with carcinogenic toxins. The Association of Perioperative Registered Nurses, AORN, you're going to see that if you look this up online. They've advocated for smoke evacuation for more than 20 years, so this is good news that it's being talked about. As we mentioned, Rhode Island, the first to pass laws regulating surgical smoke evacuation. Colorado just passed in the spring. Oregon's currently considering a bill. California's been working on legislation. They were right there, and then they towed it, and so far Washington State hasn't made a move specifically for protections on that. Reached out to some of the hospitals around here. Kaiser Permanente followed up and says, yeah, you know, this technology is evolving so fast, we're trying to evolve with it. So they currently use a suction device, kind of like we saw there, that has its own little vacuum on it. But, you know, to retrofit these rooms, to have ventilation that's strong enough to suck that out of there is a whole other ball of wax. So this is just one of those issues that who knew, right?
What a idea.
Well, you know, I think about when you're at the dentist office and they're doing all this crazy stuff, and they put the little suction in, so it's suctioning as soon as it's going out, which is what that device was trying to do, the evacuating. So it seems like there's obviously some momentum to solve it. And you doing that part. I love it.